Now, if people who are at high risk are looking for COVID treatment, there are some options out there.
One of them is a pill, but as CBS 17's Maggie Newland reports from Raleigh, they're still in small supply. And Maggie, there is some confusion surrounding who can use them and when.
There is, Angela and Rod. Now, many people don't even realize that we have these pills here in Wake County, but Health Park Pharmacy is one of just a few places that got a supply of both kinds of them. They are out of one of the kinds now, but they still have the other. You just need a prescription.
When the FDA recently authorized 2 types of pills to fight COVID, the news came with a catch. There's a very limited supply.
We started with 20 treatments of Paxlovid. We had 40 treatments of molnupiravir. I think we got another 80.
Steve Atkins, owner of Health Park Pharmacy in Raleigh, says his was one of just a handful of pharmacies in Wake County to receive the antiviral pills. According to the state health department, North Carolina's received just more than 1,600 courses of Paxlovid made by Pfizer and more than 7,500 courses of molnupiravir made by Merck to divide across the whole state.
The efficacy right now with Paxlovid is higher.
Health Park is out of Paxlovid, but has enough molnupiravir for about 100 people. Adkins says that drug carries a risk of birth defects and cannot be used for women who are or may become pregnant. But he's a little surprised it's still available given our surge in cases.
A number of providers have been trying to, be relatively conservative with prescribing, and rightly so, with patients that are over 65, patients that are unvaccinated, patients that are immunocompromised. Those are all going to be higher risk.
You need a prescription, and time is of the essence. You must start treatment within 5 days of your first symptoms.
If you wait a day before you're seen, then you're tested. It takes 2 to 3 days before your test results come back. You're already almost at the very end of that treatment window.
Now, because you do need a prescription for this and you do have to be high risk, if you test positive and you think you meet the criteria, he suggests calling your doctor or calling a telehealth provider, talking over what your symptoms and your risk factors, and then they can decide whether or not you should get a prescription for this. Again, this is in limited supply. He does expect to get shipments, hopefully, every week or so. We're live in Raleigh. Maggie Newland, CBS 17 News.
And I said we have an option now, though, Maggie. Thank you.